Researchers are studying this nutrient in human trials. It's been shown to lower blood sugar, improve insulin resistance, improve erectile dysfunction, improve immune system function, and even in some animal trials it's being shown to protect against mold toxin poisoning. Stay tuned. You're not going to want to miss today's episode of Dr. Osborne's Zone, where we do a deep dive on arginine. We'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's Zone. Welcome back to Dr. Osborne's Zone. Today's crash course, all about L-Arginine. So what is arginine? It's a conditionally essential amino acid. Conditionally essential. What does that mean? That means your body makes it, but under certain conditions, you can't make enough. And so our body can actually synthesize arginine from if you eat adequate glutamine and ornithine. These are also amino acids predominantly found in animal proteins, but you can certainly find them in things like legumes and seeds and nuts, among other food sources. But conditional essentiality, basically, you need more than what your body can synthesize in those times. And we'll talk more about that in just a moment. I'm going to kind of blow this diagram up for you because I want you to show you a little bit of the chemistry here. So you see up here, this tube represents the small intestine, and arginine is actually absorbed through dietary foods, up to, it's about 3 grams a day. You can get somewhere in the neighborhood of about 70% absorption. So it's very well absorbed, provided, of course, your intestines aren't damaged. Where we get in trouble with absorption would be conditions like inflammatory bowel disease. Those of you with gluten issues and celiac disease might have issues with absorption of arginine from the food that you're eating. Now, once you absorb it and it comes into your bloodstream, you can take L-Arginine and you can convert it down here into a substance called nitric oxide. Nitric oxide is something we'll be talking about, but in order for you to be able to do that, just again, a little biochemistry, that requires vitamins. But unfortunately, the biochemistry textbooks don't tell you what these abbreviations typically mean. So NAD, nicotine adenine dinucleotide, this is a version of vitamin B3. So this one in the middle, in order to convert arginine into nitric oxide, requires vitamin B3. But it also requires BH4, which is a form of folate, or vitamin B9, and it requires FAD, or FMN, which is a form of vitamin B2, or riboflavin. So you need B vitamins to turn arginine into nitric oxide, but you also need calcium. As you can see here, Ca2 is calcium. So for those of you who are nutrition nerds and just like to know more about the vitamins and the minerals, arginine, very important in its role there. Now, let's talk about the functions of arginine. There's several of them. You see here cardiovascular health. It supports the production, what we were just talking about, nitric oxide. This substance won a Nobel Prize in medicine. It was discovered to be critical in dilating blood vessels. So many of you that have been diagnosed with high blood pressure, as an example, constricted blood vessels can cause high blood pressure, and without adequate arginine, we can end up with blood vessels that don't properly dilate and constrict, and so it can start to affect blood pressure, hence cardiovascular health. We also know it's important for blood flow and for heart failure and other things, and we'll get into some of that in just a minute. We know that arginine enhances immune system defense by helping T cells mature properly. We know that it plays a role in the production of insulin, especially as it relates to zinc preservation. So it has a preserving effect on your zinc status. And zinc is really important. It actually is a centerpiece that holds insulin together. And then we know it plays a role in the regulation of glucose metabolism. We also know that it can stimulate growth hormone, among other hormones, growth hormone being one of them, but insulin is another one. As we just mentioned, it's a hormone, but also, ladies, prolactin is another hormone that we've seen arginine help to stimulate. And then we know it's important for muscle growth. It boosts blood flow to muscle tissue. There are a number of studies that show that taking anywhere from 3 to 6 grams of arginine an hour or so before workouts can actually improve your recovery, but also enhance your performance within the activity. And then we also know that arginine stimulates wound repair. And I'll show you some of the research on this. What's really interesting about arginine, what's really fun about arginine, in my opinion, is there are a lot of human studies on it, human trials. Unlike many other amino acids, you get a lot of human trials on arginine, and we'll do a review of some of those. You can see here, this is from this is from a review paper on arginine. In conclusion, L-Arginine has strong anti-cancer, antioxidant, anti-inflammatory, neuroprotective, cardiovascular, anti-gingival, and anti-diabetic properties. So, in essence, helps fight cancer, helps maintain integrity of DNA, helps reduce inflammation, protect your brain, protect your heart and your nerve or your cardiovascular function, protect your gums, regulate your blood sugar. Numerous researchers have shown that it is a nutraceutical that protects against a wide range of heart, liver, neurological, and reproductive system disorders. And you always get this at the end, right? However, more research is needed. And that's the case with science. Science is really never settled. I know they were trying to tell us that a few years ago, but they're wrong. Always ongoing research because we never know everything. Now, this is just an image, a diagram on nitric oxide and how it plays a role, or actually arginine and how it plays a role in immune cell function. So you can see here you have different types of macrophage cells. You see at the top macrophage M2, and then down here macrophage M1. What are macrophages? These are cells that behave like Pac-Man. Remember that video game when you were a kid? Maybe some of you do. And so what happens when you have inflammation? Excuse my drawing here, but when you have, let's say this is a blood vessel, and let's say you got some damage to the lining, and you have all this debris from that damage, this little Pac-Man will gobble up all of that debris. That's what a macrophage does, is it goes in there and it cleans out damaged tissue. If you remember, we talked recently about SPMs and why they were so important. SPMs actually help to activate these macrophage cells and turn them on, thus resolving or helping to resolve inflammation. But as it relates to arginine, you can see here, arginine, through different actions, one through this enzyme called arginase, where you make ornithine and urea, stimulates certain types of macrophages. And then you have another pathway where nitric oxide is produced, and that helps to stimulate these Pac-Man-like cells that help to regulate inflammation. So this is one of the reasons why when we say arginine enhances immune function, that's one of the reasons why. This was out of the European Journal of Medicinal Chemistry. You can see here we've got animal studies and we've got human studies with arginine, and a lot of the mechanisms of action are determined through animal research. So we know, for example, that arginine has antioxidant actions. We know that it has anti-inflammatory action and anti-aging and hepatorenal action, meaning liver and kidney function actions. We know that it can increase neuronal function. We know that it can improve in men erectile dysfunction. We know that it can enhance spermatogenesis. What is this? This is the production of sperm. So, a lot of times I see this a lot in couples. They come to me for nutrition, and maybe they're fighting with infertility issues, and the woman or the wife has been investigated aggressively, meaning they've done every test under the under the umbrella of testing that can be done in terms of fertility, but the male or the guy hasn't been tested at all. And a lot of times, in my experience, it's the man, not the woman. And so arginine is one of those that we know has an effect on sperm production. And so a man could be underproducing sperm, and that could be a reason for infertility. We know that arginine can improve insulin sensitivity and glucose absorption. We know it enhances immune function and prevents heart disease, but it also promotes fibroblasts. Fibroblasts are specialized cells designed for, these are healing and repair cells that make collagen. And so you can't do that very well without arginine. We know it also has anti-apoptotic action, so it prevents cells from being destroyed or damaged. So pretty important amino acid. Now here is a nice summary study on the potential of arginine in the prevention and treatment of carbohydrate and fat metabolism disorders or lipid metabolism disorders. And you can see each one of these little lines here. So like this first one, function is to produce nitric oxide. We'll talk about nitric oxide a little bit more. We also know that arginine improves metabolism of fat or lipids and enhances or improves lipid parameters. So for example, we know it can increase HDL type C, which is what so many refer to as good cholesterol. It can reduce triglycerides for many. We also know it can reduce inflammatory parameters. We know there are studies in humans where this enhances or improves weight loss, body weight, and then also reduces the potential for something called atherogenesis, which is atherosclerosis. Basically, if you have a blood vessel here, if you have inflammatory damage to the lining of a blood vessel, your circulating cholesterol that kind of just floats through your blood, specifically there are certain types of cholesterol like lipoprotein A, will cluster to that area of inflammation, and they'll create a fatty deposition, and that's what they call atherogenesis, this process of creating a plaque, right? And so what happens is this plaque gets big enough over time, it creates a blood flow turbulence because the vessel itself physically is more narrowed. It's going to increase your blood pressure, but if this plaque breaks off, it can also lodge into smaller blood vessels downstream and create a stroke or heart attack or other type of blood blockage. So we know that arginine helps to reduce that process. We know it can improve your sensitivity to insulin. We know it can enhance or improve glucose intolerance. We know it aids in insulin secretion, so it actually can stimulate and help the pancreas making insulin, as well as something called insulin-like growth factor. And then it helps to increase the survival of beta cells. So those of you who maybe don't know what beta cells are, they're specialized cells in the pancreas that make insulin. These are the cells that have irreversible damage in type 1 diabetics. If you know anyone that is insulin-dependent type 1 diabetic, it's because their beta cells were destroyed through an autoimmune process. And so arginine preserves these beta cells so that you can continue to make insulin. And then we also know that it aids in the metabolism of carbohydrates as well. So let's dive into some of the beneficial aspects in human study research and kind of review some of these things. So we know, you see this chart, who can benefit from arginine in the diet or arginine supplementation. We've got good data on pregnancy. I'll talk about that. We've got good data on cardiovascular issues. We've got good data on kids. When I say rapid growth, it's generally with children. One of the things that has been problematic over the last several decades is formula, baby formula. Baby formula is generally corn syrup and GMO proteins. A lot of times, especially if you're using one of the soy, soy-based proteins not so good, and then we get kids that aren't growing or kids that are not hitting their growth. And kids need more arginine than adults. It's actually, earlier when I said that arginine is conditionally essential, one of the conditions of essentiality is rapidly growing children. Another condition of essentiality is pregnancy. So in those two areas. We also know that people under high amounts of stress, there have been studies that when given arginine, people actually perform better under stress and duress. So these are all potential uses or potential case uses to justify the, taking arginine. They're more than that. As I walk through these research studies, you'll understand what I mean by that statement. So you can see this is a list or a review paper of a number of different human studies on using arginine for both lipid metabolism and carbohydrate metabolism. And this basically is a summary. So what we have here is a 2-week study using 17 grams a day orally of arginine improves nitrogen balance. Nitrogen balance is basically it improves protein balance. Elevates serum insulin-like growth factor concentrations, reduces T and C and LDL-C levels in elderly humans. This is triglycerides, by the way. And then no adverse effects were observed at doses as high as 17 grams a day, and that's again on a 2-week study. This next one is 3 grams, or rather 3 doses per day of 7 grams orally, and they found that it improved endothelium-dependent dilation, so it helped blood vessels dilate in hypercholesterolemic young adults. So this is in young patients, which might attenuate the production of atherosclerosis. And this study of 3 doses a day of 3 grams orally increased growth hormone levels in postmenopausal women, which may have implication for muscle growth and bone growth. We come down here, we've got 3 doses of 2 grams a day orally. Arginine enhance effects of exercise, inducing changes in fat profile in overweight men. And then here, 3 grams a day orally. It was found to improve lipid profile in patients with acute myocardial infarction. It regulate modified cholesterol levels and increased HDL-C. We found in 2 grams a day orally, it improves glycemia, which is blood glucose, and lipid profile, by that meaning triglycerides and HDL. You can see down here 3 doses of 3 or 6 grams a day orally decreases blood pressure, blood sugar, a chemical in the blood called MDA, which is a marker of a free radical. It reduced triglycerides and increases HDL. Arginine improves anthropometric parameters, meaning body size measurements, blood pressure, and blood biochemical indices in patients with obesity. So a lot of human trials there showing some nice improvements. Now we've got more. That's not even all. So you can see in these trials, this was one where they gave arginine through infusion, and they gave 0.52 milligrams per kilogram of body weight. Arginine improves insulin sensitivity and restores vasodilation in obese and non-insulin dependent diabetic patients. And then we get more to oral studies. So oral, that means by mouth. So 9 grams a day in 3 divided doses improves glucose disposal and systolic blood pressure. The treatment attenuates insulin-resistant and type 2 diabetes. In this one, 8.3 grams a day orally. It affected glucose metabolism and insulin sensitivity positively and improved endothelial function, reduced oxidative stress, and adipokine release in obese type 2 diabetic patients. At 6.4 grams a day, it regulated endothelial function, improved insulin sensitivity, and reduced inflammation. 3 doses of 9 grams a day, L-Arginine decreases insulin levels and improves insulin sensitivity in patients with obesity. This is 3 doses of 2 grams a day, so 6 total, increases nitric oxide and total antioxidant status. 3 times 9, L-Arginine decreases plasminogen activator type 1, which basically makes your blood less clotty or less thick and sticky, increases nitric oxide and antioxidant scores, and improves insulin sensitivity in obese patients. In this study, 3 times 9, so 27 grams a day, Arginine affects zinc serum concentrations in obese patients. Positive correlation between change in zinc and insulin sensitivity improvement was observed. At 6.6 grams a day, it improved glucose metabolism, insulin secretion, insulin sensitivity, enhanced endothelial function in patients with impaired glucose tolerance and metabolic syndrome. At 6.4 grams a day, improved beta cell function and insulin sensitivity and increased probability to become normal glucose tolerant. At 6.4 grams a day in another study, delays the development of type 2 diabetes in patients and reduce their oxidative stress. So tremendous potential. How many of you have ever talked to your cardiologist as to whether or not arginine was right for you? All they really ever want to do is pump people full of statin drugs, blood pressure drugs, and diabetic drugs like metformin. And here, what I've just shown you is a host of studies that show that arginine can have similar effects to all those different medications in human trials. So, you know, as the commercials say, talk to your doctor today to see if arginine is right for you. I think that's the conversation that you want to try to have. Okay, let's talk about more research. So this is also in humans. They did a three different diets. They did a control diet. They did a diet enriched by natural foods that contained arginine. And then they did a third diet, which was no arginine or low arginine diet, but they supplemented patients with an equal amount of arginine as compared to the high food arginine diet. And here's what they found. This was a blood pressure study, but what they found, and then both groups that were having more arginine, so in the arginine-rich diets, they found that systolic blood pressure dropped 6.2 points, and diastolic blood pressure dropped 5 points. And in the arginine supplemented group, same thing. Systolic blood pressure dropped 6.2 points. Diastolic blood pressure, a little bit stronger there, dropped almost 7 points, 6.8 total points in the arginine supplemented group. These results indicate that a moderate increase in L-Arginine significantly lowered blood pressure and affected renal function and carbohydrate metabolism in healthy volunteers. And this study was done in healthy people. Imagine applying it to people that are not so healthy. I would love to see that outcome. Here's another one. Randomized double-blind placebo-controlled study supplementing with L-Arginine in patients with heart failure. So they gave 15 subjects were given 6 weeks of arginine or 6 weeks of placebo. Compared with placebo, supplemental arginine significantly increased forearm blood flow, so it improved blood flow in their arms on average from, well, those are the numbers of the parameters they measured. Furthermore, functional status was significantly better on arginine compared with placebo, as indicated by their ability to walk longer distances in a 6-minute walking test. They also scored better on living with heart failure questionnaire, so their questionnaire on heart failure improved. Oral arginine also improved arterial compliance, meaning it made their arteries more elastic. Supplemental arginine has beneficial effects in patients with heart failure. How many of you with heart failure have ever had your doctor mention arginine as a potential versus, say, a diuretic, which is what they generally like to do a lot of in heart failure? And unfortunately, diuretics actually contribute to heart failure because they block vitamin B1, and that can contribute to congestive heart failure as well. Here's a study review on arginine for erectile dysfunction. And so, guys, if you've struggled with erectile dysfunction, arginine may have a tremendous impact. Positive evidence is available for the efficacy of arginine and its various combinations. The dosing, you know, for a lot of these studies on these reviews are anywhere between like 3 and 6 grams of arginine a day, and some go even higher. But point being, this is an amino acid. Now, let's go back to kind of the fundamental of understanding this. I said this is an amino acid. Where do they come from predominantly? All amino acids. The bulk of high-quality amino acids in the human diet comes from animal foods. Eggs, chicken, fish, turkey, beef, lamb, etc. Now, you can get some from plants, nuts, and seeds. There certainly are, but quantitatively nowhere near the level. And what we've seen in the last number of decades is a war on protein. You know, you still see it. It's being fought every day in the nutritional trenches, so to speak. But there's this huge war on protein where there's an attack. And when we battle and we attack, what we actually do is we create protein malnourishment through amino acid deficiencies. And I've seen more and more over the last many years, more and more amino acid deficiencies where people are scared to eat protein. You know, they've been told the animal protein is going to cause heart disease, cancer, and every other nefarious chronic autoimmune degenerative inflammatory disease on the planet. They're even trying to blame animal farts on global warming, and I think that's kind of a ridiculous notion. We need protein. Humans need protein. There's 20 amino acids, so we're talking about arginine being one of those 20. 9 of them are essential, meaning you have to get them from food. You can't make them. Whereas we've talked about with arginine, it's a conditionally essential amino acid, meaning that you can make it from the other 9, but you can't make it enough under certain conditions like growth and pregnancy, etc. So it's very important to take that in context, because how many of you are limiting your animal foods because you have a cardiologist that told you to? And here we're talking about one of the primary constituents of animal food, amino acid called arginine, being capable and successful of lowering blood pressure, lowering triglycerides, reducing platelet clotting in your blood, as this study shows, which we'll talk about. We know it improves insulin sensitivity. We know it can reduce your weight. So why wouldn't we consider having protein with adequate amounts of arginine in our diet? So here, this study was talking about arginine being used for platelet aggregation. Now, platelets are what clot your blood. So in this case, they were giving 8.4 grams a day orally or a placebo, and this was a 2-week study. And what they found, and again, it's double-blinded, placebo-controlled, that dietary arginine supplementation can modestly attenuate the increased platelet reactivity seen in hypercholesterolemic patients. So basically, it thinned the blood. It reduced the potential for the blood to clump and clot, which is one of the risk factors associated with cardiovascular disease. But that's not all. Let's talk about more research. Let's talk about pregnancy. For those of you who maybe currently pregnant or know somebody who's pregnant, L-Arginine supplementation in pregnancy. This is a systematic review of maternal and fetal outcomes. And so in this particular review, they actually took 1,028 publications, but of those, they pared those down to 51 studies that were eligible for their criteria in their research review. 25 of these studies were performed in women, and the rest were performed in animals. So this is a mixture of human-animal study. Arginine reduced the development of preeclampsia. 4 studies showed that. So if you've ever heard of preeclampsia, it's when the blood pressure goes up during pregnancy, and it can create life-threatening situations and hospitalization for pregnant women. As you can see here, decreased blood pressure reduced the need for antihypertensive drugs in women. So it kept these women also off of medicine during their pregnancy, which we want to do. You know, there's always a risk giving a pregnant woman medications, and so if an amino acid can reduce the risk and potentially lead them to not needing that hypertensive medication, that's a win. In women carrying growth-retarded fetuses, arginine improved fetal-placental circulation. So it improved the blood flow to the baby, birth weight, and neonatal outcomes in 5 studies, while in the case of threatened preterm birth, arginine reduced uterine contractions. In several animal species, arginine supplementation in pregnancy improved reproductive performance by increasing the litter number and the size. Moreover, in preeclamptic and metabolic syndrome experimental models, maternal hypertension and fetal growth were improved. So, both human and animal studies enhancing pregnancy outcomes, reducing the potential for blood pressure issues and preeclampsia in pregnancy. Here we have another study, and this is in humans. This is a human response. So we've got arginine enhances wound healing and improves lymphocyte immune response in humans. So we had this study was randomized into 3 groups. Supplement of 30 grams of arginine in one group, a supplement of 30 grams of arginine aspartate in another group, or a placebo. The supplements were given orally. They were given for 2 weeks. Arginine supplementation significantly enhanced the amount of collagen deposited into standardized wounds. So this was a wound-based study, and so they showed that it enhanced and accelerated wound healing. Additionally, arginine supplementation at both doses increased lymphocyte mitogenesis. That means it enhanced lymphocyte production in response to the damage. And the data suggests that arginine may be of clinical benefit in improving wound healing and immune responses. Now, I've seen this for years. We've given supplemental arginine and glutamine and other amino acids in people that were going into surgery. And for years we've seen our patients heal 2-3 times faster than people not supplementing with key amino acids to aid in the healing process post-surgically. So this is just another study corroborating that type of information. Now, we've also got, this is interesting, on cancer, and this is there's a class of medications. If you ever heard of immunotherapy, it's all the rage now in cancer treatment. But you can see the discovery of immune checkpoint inhibitors, which is, again, this is a form of immunotherapy. What they found is that not everybody responds real well to immunotherapy. It's actually been kind of a letdown in the cancer world because it had all this promise, and then people just weren't responding really well. So what these researchers were doing was they were trying to figure out why some people respond and others don't. And one of the things that they found was that patients that had low arginine levels at baseline were significantly and independently associated with worse clinical benefit rate, progression-free survival, and overall survival. So they didn't do as well, and they didn't survive as well, the ones that had low arginine on the front end. So here you go, conclusion. We demonstrate that baseline arginine levels predict immune therapy response in cancer patients. Plasma arginine quantification may therefore represent an attractive biomarker to tailor novel therapeutic regimens targeting the arginine pathway in combination with the medication. I mean, that says a lot right there. And I know this is not a definitive research study for all people with cancer, but what it's basically saying is people with arginine deficiency don't do as well with the treatment. And go back to what I said earlier, which is we've demonized protein, especially in the cancer world. Look at how many websites, how many even government entities tell you avoid animal proteins if you have cancer, go plant-based if you have cancer, and here you are setting yourself up for failure because your body requires amino acids to function, especially when you're sick. Especially when you're sick. Here's another study on exercise performance. So arginine supplementation, similar to the effects of increased dietary nitric oxide intake, elevating nitric oxide bioavailability through dietary arginine supplementation reduced the oxygen cost of moderate intensity exercise and blunted the VO2 slow component and extended the time to exhaustion during severe intensity exercise. So, maybe some of you are trying to train a little bit more aggressively or heavily, and you're frustrated and you're intolerant to the exercise. What they're showing is that arginine supplementation, and in that most of the studies around arginine, the doses are like 3 to 6 grams 1 hour before the workout. So if you're looking to try this, that's where you want to kind of lean or start. So somewhere in this neighborhood. More studies. So these again, we're talking about pretty much predominantly all human studies so far, right? Here's one recently done on adding arginine to patients with COVID-19, and this was a double-blinded, randomized, placebo-controlled trial as well. And so what you can see here, the parallel group study done on patients hospitalized for severe COVID-19. Patients received 1.66 grams of arginine twice a day, so approximately 3.3 grams a day, or a placebo. And this was given orally, not IV. What was the outcome? In this interim analysis, adding arginine to standard therapy in patients with severe COVID significantly decreases the length of hospitalization and reduces the respiratory support at 10 days out. So improvement there. And we go back again to protein. Why protein? Well, arginine has special functions, but protein as a whole is where we get arginine. So don't forget that. Don't throw away the food group. Don't, as the proverbial saying goes, don't throw away the baby with the bathwater. Don't abandon your protein because a bunch of people online are telling you that plant-based or animal-based diets are dangerous. Okay, now we're going to get into some animal studies. L-Arginine metabolism inhibits arthritis and inflammatory bone loss. Now, this is a study that was performed in transgenic knockout mice, but also in human serum. So they took sick people's serum and they took transgenic mice, and what they came to as a result of doing this study is they demonstrated that arginine ameliorates arthritis and bone erosion through metabolic reprogramming and perturbation of purine metabolism and osteoclasts. Let's make that sound English. Basically, it helped to regulate osteoclasts. Osteoclasts are the types of cells that degrade bone, and so taking arginine, supplemental arginine, enhanced the regulation of osteoclast production, and so you had less bone loss and less overall inflammation. And I think that's the important takeaway. It's the same thing we see, as I mentioned earlier, with post-surgical outcomes when people are having scheduled inflammatory trauma, because that's what surgery is. When we get them on arginine and other amino acids, they heal faster. They have less inflammation. They have less surgical complications. I thought this was interesting. This year I'm talking a lot about mold. For those of you who follow me, you may already know that. And so we're looking at nutrition under the lens of mold and mycotoxin poisoning as well. And so I would be remiss to not add a little bit of information here. There's several studies in animals, not in humans, but several studies in animals on how arginine can do several things. In this particular research study, this was done in growing pigs, and what they found is that when they gave the pigs arginine supplementation, it remedied liver injury caused by mycotoxins. So basically, it helped their livers. It helped protect these growing pigs' livers. And you have to understand, in the farming world, that means everything to the farmer, because most animals in the farming world, what do they feed them? They feed them grain, and even worse, predominantly GMO grain. And one of the bad things about grain is it's very highly contaminated with mold toxins. And so this can make animals sick. It can make adult animals not have any more babies. It can kill them. It can cause liver damage and kidney damage and cancers. And so as a farmer, this is your livelihood. You don't want your animals to die, but you also want to be able to get cheap grain. This is a cheap way to feed your animals. You don't want to spend more feeding them than what you have to, but feeding them bad things, you also don't want them to die. So adding supplements to their feed has been a long-term solution to offset mold and mycotoxin damage, and arginine is one of those things that's been shown to be beneficial. There are other studies that show that arginine reduces mold toxic exposure in other ways as well, but this is one of the main ones that I wanted to show you today as it relates to mold. Okay. So let's talk about arginine supplementation and possible side effects. So I've shown you a lot of research studies today in people, doses as high as 30 plus grams a day. So we're talking about pretty high doses. Now, in my experience, when you stay in this kind of 3 to 6 grams a day dose, you don't generally tend to see a lot of side effects, minus one, and we'll talk about that one in a minute. But as far as GI side effects, that's usually 9 plus grams a day, diarrhea, nausea, bloating. Of course, everybody has a unique experience, so if this is what's happening to you, you might reconsider how much you're taking. Now, one of the other things is herpes virus activation. So if you've ever been diagnosed with herpes simplex 1, where you get fever blisters, or even sexual herpes type 2, where you get genital blisters or sores, arginine in high doses can activate herpes virus, and it can cause you to have more flares. So keep that in mind. If you have that diagnosis prior, this may be something that isn't the best fit for you. And I would say if you do have that, you would want to probably take lower doses, not quite 3 to 6 or higher, but probably you'd want to be somewhere in the 1 to 2 grams a day range. 1 to 2 grams per day, and you'd probably want to offset that a little bit and take lysine. So you'd probably want to take 1 to 2 grams a day of L-lysine with it, because the reason why this happens is these two compete. Lysine and arginine compete for the absorption receptors in the gut, and so there have been a number of studies that combine both arginine and lysine with enhanced benefit. But if you have that, you definitely would want to consider using the lysine with it. And I would encourage any of you who are thinking about this, go also watch my lysine crash course as well and get more additional information about lysine. But again, arginine can cause a lysine depletion, which can activate viruses like herpes virus. We have hypotension as well. This stuff vasodilates your blood vessels, and if you have already a very low blood pressure where you're already struggling, like some people with POTS disease are not, they may not do as well with arginine because it takes their blood pressure down too low. So if you're one of those with that type of diagnosis, just be aware of it, and if you're going to use it, start with lower doses, monitor your blood pressure, talk with your doctor, and be cautious. Now, if you're taking blood pressure medicines and you start arginine and your blood pressure drops, as I showed you earlier, that systolic pressure, and where one study dropped, or rather the diastolic pressure, that bottom number dropped 7 points. So think about that in terms of all the studies I've shown you over the years about blood pressure. So like magnesium can drop your blood pressure 5 to 10 points. CoQ10 can drop it 5 to 10 points. Arginine can drop it. Vitamin B1 can drop it. If you're doing all these things, you might be getting a compounded effect. If you're on blood pressure medicine, monitor your pressure, because if you start getting super tired, super dizzy, it's very possible that your medicines are now working too strongly. They're working too strong because you've added the synergism of good quality nutrition to that mix. So just keep that in mind. And if this is you too, watch my crash course on blood pressure if you haven't. We've got hundreds of crash courses in our library, on our channel. So just, take advantage of those. Those are free for you to learn and educate yourself about nutrition. Now, going back to the herpes virus activation, if you look at the structure of arginine and you look at the structure of lysine, they're very similar, and this is part of that competition with each other, as they compete for the same receptors in the small intestine for absorption. So that's the reason why. Again, some of you chemical nerds might enjoy that slide. Let's talk about food sources of arginine. It's pretty simple here. These are grain-free food sources. For those of you who follow me, I'm more famous for my work around no grain, no pain. If you haven't read my book, I highly encourage you to get a copy. So we always talk about grain-free sources. And so what do we have? We have meat and poultry and seafood and dairy. These are probably the bigger and highest sources, if you will. So this is going to be best bang for your buck. But there are plant-based sources as well. Legumes are good sources of arginine, or can be, and then nuts and seeds as well. So, pretty simple. Eat more arginine. Let's talk about lab testing. So there's two major kinds of lab tests that generally can be used to measure arginine levels. The most common, and the one that most doctors, if you ask, could potentially run is this one right here, the plasma. And so that reference range, 32 to 150 micromoles per liter, is a pretty standard reference range across the board. And so if you're falling, really, in my opinion, if you're falling below 50, you probably want to look at that. Now, the problem with plasma is that it reflects your last meal. It reflects your last day, if you will. The half-life of arginine is not very long, but it reflects your last meals or approximate day of consumption, as opposed to reflecting kind of your long-term status. So you could have, for example, you could have eaten a meal that was decently high enough in arginine and then go get your blood work drawn the next day, and you could have what looks to be like normal levels, but in reality, if you've been on a more of a lower protein type of diet for an extended period of time, that meal prior to the test could really trick the test. So my favorite way to measure for long haul is what's called INA, intracellular nutrition analysis. And this is, INA is a form of what's known as lymphocyte proliferation. It's a very accurate way to assess nutritional status over a 6-month time frame, because the use of the lymphocyte, they have a 6-month life cycle. The use of lymphocytes to do the analysis allows us to get that 6-month window versus that, reflection of the last day or so of what you've been eating. So this is going to be a more accurate long-term status. This is going to be more just kind of a spot check, if you will. But if you have no options, better to have some data than zero data. I love testing versus guessing, so I'm a fan in that regard. If you ask your doctor for INA and they look at you like you have horns coming out of your head, you can come visit me at glutenfreesociety.org. We'll put a link in the show notes for you, and you can check out and read more about intracellular nutrition analysis as a means to measure your arginine status. Okay, so all that being said, let's finalize out on dosing. So are you considering using arginine? So I've shown you a huge range of doses today, but if we're talking about kind of a base dose for arginine, we're talking about 2 grams or so a day. Now, if we're talking about we want to get a little bit stronger, more therapeutic, and this goes into what your goals are. So like if you're really trying to improve erectile dysfunction or cardiovascular function, most of the research is going to be anywhere from 3 to 30, and that's a huge range of a difference. So 3 to 30 grams per day over split dosing. So you wouldn't want to take, for example, all 30 grams at one sitting. You'd want to split that out over 3 doses if you're going that high. My advice is if you're getting up over 6-7 grams, then work with a doctor or an expert, a nutritional expert, to monitor you. It's just would be a smart thing to do. Monitor your levels. If you're going to get up into those higher ranges, work with an expert. But this should give you some context for how you can go about using arginine as nutrition support in your day-to-day life. So there you have it, our crash course on arginine. I hope you found it helpful, and do me a favor, if you enjoy the Dr. Osborne Zone, consider using our resources. We have a tremendous amount of videos on YouTube. If you've not already subscribed, make sure you come over and subscribe and check out our crash course library, where we go deep on many, many different types of topics, vitamins, minerals, different types of diseases, etc. Also, come visit me at Gluten Free Society if you're looking for high-quality supplements. We carry over 100 products, and we appreciate your support in using our products for your nutritional needs. It helps us keep the advertisers at bay, and it helps us keep the show running. So thank you so much for your support. Thanks for tuning in. Don't forget to join me Thursdays at 12:30 Central Standard Time for our live Pick Dr. Osborne's Brain Q&A. So bring your toughest nutrition questions every Thursday at 12:30 Central Standard Time right here on our channel. Thanks, and have a fantastic day. We'll see you in the next show. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.